All right, so the next muscle that we'll be doing is the adductor magnus. First, we'll perform the AMC and S testing on the muscle. In order to do this, we'll have the patient laying supine on the table. In this case, I'll be checking his left leg. I would do this on both sides. In order to check it, we're going to have the patient fully externally rotate from the hip. I'm going to be coming in, reaching underneath the patient's leg and cupping the calcaneus. I'll be stabilizing the other leg to make sure that they don't compensate by bringing the other leg across. When I say go, I want you to resist me pulling your leg out for 2 seconds. Ready, go. Hold 1, 2. If I would notice any weakness there, I would go ahead and perform the defimat protocol. In this case, we'll be palpating up at the ischial tuberosity, at the origin of the adductor magnus. So I'll have the patient turn on their side. Go ahead and lay on this left side for me. And elbow farther forward. So I will find the ischial tuberosity to the sit bone and come just a little bit anterior to that, to the origin of the adductor magnus. Palpate at those fibers, and then I'll go distal down into the middle 1/3 of the linea aspera on the femur. So find the hamstrings, come in a little bit medial to that, dive deep in on that middle 1/3 in the insertion point of the adductor magnus. After the defimat is performed, I'll have the patient turn back on their back and we'll perform the pit contractions. And so the patient is going to fully externally rotate the affected side, and they're going to perform 6 contractions for 6 seconds at 10% effort. So I want you to push 10% effort in this heel into my hand. Ready, push. 2, 3, 4, 5, 6. I'll have them perform 6 of those contractions, holding each one for 6 seconds. So the next muscle that we'll be checking are the vertical fibers of the adductor magnus. The last one we did were the oblique fibers. So for the vertical fibers, we'll have the patient laying supine on the table. I'll be checking the left leg for the video, but we would be performing it on both sides. In this one, we're going to have the patient actively internally rotate the femur as far as they can go. I'm going to then use my action hand to stabilize at the calcaneus so they can maintain that internal rotation, and then I'm just going to simply stabilize the other leg. In this case, I'm going to be checking, I'm going to be pulling straight up into hip flexion while the patient resists. So when I say go, resist for 2 seconds. Ready, go, hold 1, 2. If weakness was tested there, we would go ahead and perform our defimat protocols. So we'll have the patient go into the side lying position. Lay on your left side for me, please. We'll flex that uninvolved hip out of the way. The origin for the vertical fibers of adductor magnus is the most posterior portion of the ischial tuberosity. So we'll palpate that isch tube. We'll go ahead and palpate those fibers. Once we've palpated those fibers, we are going to palpate the medial condyle, that adductor tubercle on the medial condyle of the femur at the insertion point of adductor magnus. And once those were performed, we'll have the patient turn back onto their back. We'll have them actively internally rotate as far as they can. Stabilize, keep that internal rotation. I want you to push your heel down into my hand at 10% effort for 6 seconds. Ready, push. 2, 3, 4, 5, 6. The pick for this would be 6 contractions at 6 seconds each. All right, the next protocol that we'll be doing is the adductor longus muscle. In order to test this muscle, we'll have the patient laying supine on the table. We're going to be checking the patient's left leg in this case, although we would normally be checking both. In order to check this muscle, we're going to lift both legs up off the table about 1 to 2 inches. We're going to fully externally rotate the side that we're checking. We're going to abduct the uninvolved leg and then adduct the leg we're checking, just to sort of kind of meet in the middle. This is all done actively from this position here. We're going to keep that full external rotation. I'm going to be trying to pull your leg out. Don't let me. Everything you got. Ready, go. Hold for 1, 2. If we noticed any weakness on that leg, we would go ahead and perform our DFMAT. I'm going to show on the right leg, even though I would do it on the leg that I just tested, but it'll be a little easier to see here. So since he's a man, we'd ask him to move anything over to the side that we needed. We would then palpate the pubic tubercle and palpate those origin fibers of adductor longus. Once we were done with that, the easiest way would be to have the patient go back into the sideline position. Again, I'm going to show you on the other leg, although I would be doing this consistently on each side. And we would go to that inferior 1/2 of the linea aspera, where that adductor longus inserts onto the femur, and palpate those fibers. After we performed the palpations, the DFMAT would have the patient roll back onto his back. We're going to come back into that externally rotated position, actively abduct, and then adduct the affected leg. I'm going to be, actually you're going to just be pushing into my hand, about 10% effort. Ready, push, 2, 3, 4, 5, 6. We would perform 6 of those contractions for 6 seconds each. All right, the next adductor muscle that we're going to be checking is the adductor brevis muscle. And so in this case, I'm going to have the patient laying supine on the table. We're going to have them actively internally rotate the femur as far as they can. We're going to bring that leg up into just enough flexion where we can get him a little bit more midline. So from here, I'm going to stabilize with the other leg. I'm going to ask the patient to hold that internal rotation and try to resist my pulling into abduction across that frontal plane. Ready, hold, 1, 2. If there was a weakness tested there, or if we noticed any weakness, we would go ahead and perform our DFMAT. In this case, we're going to go up to the pubic ramus again. So we're going to palpate that pubic symphysis, come just lateral on that right side, and palpate those fibers on the pubic ramus. Once we performed our palpations there, we're going to go ahead and bring their leg up into some flexion and external rotation so we can palpate that sort of middle portion, middle 1/2 of the linea aspera. So we find the quads, we find the hamstrings, come right in between, right into the insertion point of adductor brevis. We'll perform our palpations on the insertion. We'll come back down. We'll go ahead and actively internally rotate, flex that hip up a little bit, come across that midline to about right there, and I want you to just push your heel into my hand for about 10% effort for 6 seconds. Ready, go ahead. 1, 2, 3, 4, 5, 6. So we'll have the patient perform 6 contractions at 6 seconds each for the PICs. All right, so the next muscle we'll be assessing is the pectineus muscle. In order to assess this muscle, we'll have the patient laying supine on the table. What we'll have the patient do is go into full external rotation, slight flexion, and then adduction across the midline. Keeping that full external rotation, I'm going to be stabilizing the opposite malleolus and pushing into extension and abduction as the patient resists. When I say go, fight back for 2 seconds. Ready, go. 1, 2. If that muscle tests weak, we'll go ahead and perform the DFMAT. The origin of the muscle is the superior border of the ramus of the pubis, and so we'll palpate the pubic bone and come slightly to the superior portion of it. We'll palpate those origin fibers at the pubis of the ramus of the pubis rather, and then we'll slide, bringing the patient into a little flexion and external rotation. We'll palpate down that adductor group to that superior anterior portion of the pectineal line, and we'll palpate those fibers. Once our DFMAT has been performed, we'll go ahead and perform our PIC contractions. In order to do that, we'll have the patient go into full external rotation, flexion, adduction, and all I want you to do is push your heel, your foot into my hand for 6 seconds at 10%. Ready, push. 1, 2, 3, 4, 5, 6. I would perform 6 of those contractions, holding each one for 6 seconds. The next muscle we'll be assessing is the gracilis muscle. In order to assess this muscle, we'll have the patient laying supine on the table. We're going to have them come into active internal rotation of the hip, and then they're going to slightly adduct the femur just to that neutral position. The action is going to be, I'm pushing straight into abduction while they resist. I'm stabilizing the opposite leg, the opposite malleolus. I'm going to push out for 2 seconds. Don't let me. Ready, go. 1, 2. If there's any weakness there, we'll go ahead and perform our defimat. The origin of this muscle is the inferior ramus of the pubis. So we're going to palpate those, we'll palpate the pubic rami and palpate those origin fibers. Once those palpations are done, we're going to bring them into flexion and external rotation, and we're going to palpate down to the pes and serine, which is in that medial aspect of the knee right below the femur. So we'll palpate the pes and serine insertion point. Once our defimat is done, we'll go back. We'll have the patient internally rotate, slightly adduct to neutral. You're gonna push into my hand at 10% effort for 6 seconds. Ready, push. 1, 2, 3, 4, 5, 6. We perform 6 of those picks for 6-second holds on each one.